Hi everybody, Dr. Valerie Alikakos, your chiropractor nutritionist. So today we're going to talk about correcting our posture. And we spoke in the other video the importance of postural correction because it almost instantaneously can alleviate pain syndromes from mild to severe, believe it or not. It works on the biomechanics of the body. It helps increase your energy. It helps increase your breathing. It helps increase your mood, go into a better mood, etc. So we're just going to do a quick little assessment and correction of our postures today. And I'm going to apologize in advance because I'm going to be standing up and I don't have an assistant, so I'll be standing up. It'll be a little bit of an awkward position maybe to be seeing me in, but you'll be able to see the full body so I can go ahead and guide you. So posture is important from when we're standing, when we're sitting, even when we're sleeping. So when you're sleeping, you want to just picture yourself standing in that position that you're sleeping in and say, would this be a good posture to be in? Oftentimes it's not. So you want to just kind of neutralize that position. The body in general wants to be in a neutral position. It does not want to be in any exaggerated position. It wants to be aligned, and this way it can all the segments can just float one on top of the other. They're all doing their own thing, carrying their own weight, and just working together instead of just dumping yourself, dumping your head on your shoulders and ribs on your hips, etc., all the way down. So you want to be able to just kind of, retrain yourself to lift your posture and let all the segments work on their own and, put themselves in the position that they should be in. They're all separate and we should, keep them as such. So that being said, let's take a look at what we're going to do with our posture. One of the things that we want to do with the posture, or main thing that we want to do, is kind of separate our hips from our rib cage. So I'm just going to stand up now and I'm going to just show you. We want to separate our ribs from our hips as much as we can. So instead of just dumping it and bringing them together, you want to just lift, and then let everything just loose. So you're lifting up the rib cage and just slightly engaging your core. This way you're not just dumping your body. Do you ever see dancers can fly through the air and you're like, how on earth did they do that? Yes, it takes a lot of training. However, it's also because they segmentalize their bodies like that. They use the correct muscles to just get all the pressure off the rest of the body. There's all different segments here and they're made to kind of carry themselves. So we're lifting and separating the rib cage from the hip, and then we're relaxing the shoulders and the head. They have nothing to do with it. We also want to, when we do that, is not arch the back. So we don't want to lift. This is a big tendency that we're doing. Okay, so almost everybody across the board does that. So we just want to lift and keep neutral. We don't want to start doing this. Keep neutral. This engages our core and really helps get the muscles that should be working, keeping us upright working, which is the core muscles basically. So that's one thing that we want to do. Second thing that we want to do is lift the rib cage. When we lift the rib cage, I'm sorry, the breastbone here. When we lift the breastbone, we don't want to just lift it out. We want to just lift it up. So that will include lifting the back part of it, the spine. So you want to just lift, again, not out, just lift. Do you ever see in a casinos when they're playing with decks of cards and they're just opening up the deck of cards and all the cards are just opening up like that? That's what you want to think about with your spine, right? The spine's all little segments of bone, so you just want to think about lifting up every segment of your spine and elongating it upward. And then you want to just keep the shoulders and the head relaxed. They have nothing to do with it. They'll fall in their proper place. So I don't want to see any of this, and we do all sorts of things. We tighten up our neck. We don't want to do that because it's going to tire out the body even more. So you want to get into the correct posture and then just relax the rest of your shoulders. So if we do that, we'll start to have a much better alignment. We're going to go from this, which is a very typical posture, to this. And this, you'll see, the shoulder, the hips. You can't see my ear, but the ear is basically aligned down to the knee and down by the ankle as well. It's one aligned, segment, basically, going down in that way. You don't want to jut the head forward like we usually do when we're in a slumped posture. I mean, your neck is working so hard to keep the head up. It's like holding up a bowling ball, for crying out loud. But if you just correct the posture and sit up, your head's just floating on top of your shoulders. When you lift the rib cage, your upper body's just floating on your lower body. So these are all like the major things that you want to do and really alleviate the stress and pressure that happens on the body and feel much, much better. I'm going to follow up with segments on specific stretching exercises and strengthening exercises to help with different pain syndromes, neck, shoulders, low back, sciatica, numbing and tingling down the arms, any of these things. Anybody have any suggestions? Just write them on the bottom or in the email, depending on how you're getting this video. And let me know and I'll try to accommodate as best I can. Thanks so much, everybody. Have a good day.